Hello, everyone. I'm Robert Kirstein, and I just want to take a few minutes to introduce you to the new Handbook of Research on T-Scan technology applications in dental medicine that's being released this month and published by IGI Global. And this is a compilation of all the benefits that T-Scan brings to patient care. And you can see the list on the right of many of the areas that the T-Scan has made major differences for patient well-being in the different disciplines of dental medicine. I'm going to focus on the top two: airway opening without appliances or surgery, and dental implants and controlling complications with dental implants. There are two new chapters about these things. And so let me share that information with you. The first one, Dr. Atul Satur has found that he can expand the airway physiologically without appliances or surgery by using DTR therapy, diffusion time reduction therapy. So I'm going to show you a couple of examples of that. And Dr. Jim Oshetsky has found that he can control implant complications by using T-Scan to deliver implant cases that, despite being made by the digital workflow hasn't been able to control implant complications en masse, which is a huge problem affecting implant dentistry. So Dr. Satur's chapter has examples of how the airway can be expanded by physiologic relaxation of the oropharyngeal muscles, and that's because of the swallow mechanism. So here's an example of that. You see the airway. It's fairly open. It has a 265.7 millimeter square volume. But after DTR therapy, you see it got broader at the top. It grew a section in the middle, and it became much broader at the bottom. And the airway volume went up 300 to 300.9 millimeters. So that's almost a 50 millimeter squared increase in airway volume. Again, no appliance, no surgery, just through occlusal therapy guided by the T-Scan. Right? When you look at the CBC reconstruction, here's the pre-DTR condition of the airway. Now look at the post-DTR condition. You see a whole section grew. The upper airway became much wider or broader, mesiodistally or anterior-posteriorly. The base got much broader, and the increase again was 50 millimeters. Here's a different example, also highlighted in the chapter. You can see this conical airway, and the volume is 100.5, which is small, millimeters squared. And then after DTR therapy, you see the conical nature disappeared, and the airway became much broader, especially in this area. And the airway volume increased to 157.1 millimeters squared. And when you look at the reconstruction, the CBT reconstruction, you can see the constricted airway, how it gets smaller going down to the esophagus area. And then after DTR therapy, it grew a new section. It got much wider through the middle and also at the base, increasing by 57.1 millimeters squared. And that's all physiologic. So if you want to learn how to open the airway without making appliances that people don't have to wear, that you don't need to do surgery, that you can do it all physiologically, you should look into reading Dr. Satur's chapter. In Dr. Oshetsky's chapter, Digital Occlusion Technology's Role in Preventing Complications in Implants, it highlights this study, which has just been published, that shows when you install cases with T-Scan, implant cases with T-Scan data, to choose the articulating paper, you have a lot less complications. So in this case, the paper-only complication rate was extremely high. 24.5% of the implant cases that were installed had complications, whereas T-Scan data guiding the articulation papers, contacts that are chosen, only 1.8% complication rate, translating into 10 times less complications when using T-Scan data. So this chapter goes on to explain how that's done. So I'll just give you a quick example of this two sets of all-on-6 implant reconstructions opposing each other. Here's how it was adjusted with paper only. And you see there's rapid rising force in the tooth number 12 area. Then the posterior right becomes high force, and then back to the posterior left. And so this is what causes torque. So how you use this information, how you use the T-Scan information, is you map it to the articulating paper marks. And then you adjust only the fast rising, high force overloaded areas. So that would be these few contacts. This is a moderately forceful contact. That one you might not treat. You'd only treat those few. And then this one, which is way back here, and you leave the other low force contacts alone, and then you make a new movie. So this is a little later in the process, and you can see that there's still earliness to the left, and then excessive anterior pressure, and then right posterior extreme overload. I'm sorry, left posterior extreme overload. And you see the center of force travels to the left. And again, you use the data to show you which articulating paper marks require treatment. So here, the most distal lingual area has to be adjusted, but the mesiolingual area is all low force, so you leave that alone. And this is the beauty of using T-Scan data. It shows you exactly where you have to adjust and what to leave alone. And here's an example of, this is a little more forceful. These two places are a little more forceful than the rest of the areas. So you would only treat these two areas on the right side. And by the time you get to the end, you have a much more simultaneous loading. And you can see this fairly uniform evolution of forces, similar forces. There's very good balance with the center of force. There's still a little extreme pressure, which is in this area here, which we can adjust and smooth out that shape. That little sharp edge there is what's creating that. And when you compare the two using paper only, which is what you're seeing here, rapid uneven force rise, extreme posterior force rise afterwards, and then more later, another posterior extreme force rise. And again, that's what causes screw loosening, because the prosthesis gets pressed in and out as it's being loaded, as opposed to being loaded simultaneously, which is what you see here, where everything loads about the same and there's just slight differences in force and timing. And of course, we still have to correct this area. So if you want to learn about how to use the T-Scan data plus articulating paper method in detail, you want to read Dr. Oshetsky's chapter. And this is the website link for the new T-Scan Research Handbook. And if you're interested in ordering one, you certainly can use my head editor discount code, which you use at checkout, IGI40, and that'll give you a 40% discount on the purchase. So I hope you go check out the website. It has all chapters are described there. Every chapter's abstract is there, so you can read about every chapter and get a feel for how in-depth the T-Scan applications are in many, many disciplines in dental medicine. And so I want to thank you for your time. If you have questions for me, please reach out to me at my email or my phone number, or if you have questions about the T-Scan technology itself, you certainly can contact Mr. Shane Varga of TechScan.